everyone. Thank you, Annette. Good morning. My name is Linda Jackson, and I'm the director of the Center for Arts and Health within the Institute for Hope at the Metro Health System in Cleveland, Ohio. And I'm also a member of NOAA's Conference Planning Committee. We are so pleased to have the World Health Organization as part of the NOAA conference this year. NOAA would like to thank Metro Health for their support of this plenary and for advancing the field of arts and health. And at Metro Health, we are so honored to support today's plenary entitled Advancing an Equitable Global Arts and Health Agenda. We're so pleased to have today's panelists with us. KHALID ALBAIH, an artist, political cartoonist, illustrator, and designer and writer. Christopher Bailey, Arts and Health Lead, the World Health Organization. INJONGE KARANGWA, Director of Arts and Culture in the Global Public Health Engagement, University of Global Health Equity. Susan MAGSAMEN, Founder and Executive Director, International Artist Arts and Mind Lab. And NISHA SAJNANI, Director, Graduate Program in Drama Therapy at NYU Steinhardt. Of course, for a full bios of our speakers are available in the speaker section of Attendify, but please join me in a very warm virtual welcome for our panelists.
Thank you so much, Linda. And thank you for that wonderful session that just preceded this panel. There's a lot to think about there. This particular panel, we're going to be focusing on the development of a global agenda for the arts and health from the lens of equity, from global health equity. And Linda, you've provided a bit of an introduction. I'm going to say a little bit more because I think it helps to situate the people that we have here on this panel in this particular conversation. I'm going to come back to you, NISHA, and as you heard, everybody, NISHA Karangwa is the director for the Arts and Culture and Global Health in Public Engagement at the University of Global Health Equity in Rwanda. She's also a singer and songwriter and oversees the prolific Hamwe Festival at the University of Global Health Equity, now in its third year, I believe. Is that right, NISHA? I think it's in its third year. It's very exciting. It's an annual event with the mission to celebrate the contributions of creative communities in advancing global health equity and to enable artists, scholars, and global health professionals to collaborate to generate global health results. You've heard a little bit about KHALID ALBAIH, who's one of the most prolific political cartoonists in the world. His work, which is a confluence of journalism and art, first came into prominence during the Arab Spring, and is one of the most influential Arab cartoonists of his generation. KHALID champions freedom of expression around the world, commenting on subjects such as immigration, race, power, conflict, and identity. And currently, KHALID aims to extend the reach and impact of his work by giving other artists in Sudan the resources and empowerment that they need to make their own cartoons and to focus on health and healing after the trauma of protest and revolution. We have Christopher Bailey with us, who's the Arts and Health Lead for the World Health Organization, a program which is focusing on the research agenda, on community implementation, and mobilizing the global media to explore, understand, and support the health benefits of the arts. We'll be hearing much more about all of this. And I will also add that Christopher, prior to joining the WHO and during, has been a professional actor and a playwright. Susan MAGSAMEN, you've heard, she's the founder and executive director of the International Arts and Mind Lab, a pioneering neuroaesthetics initiative from the Peterson Brain Science Institute at Johns Hopkins University School of Medicine. And her body of work lies at the intersection of brain sciences and the arts, and how our unique responses to aesthetic experiences can advance our health, well-being, and learning. And in addition to her role with the International Arts and Mind Lab, she serves as the co-director of the NeuroArts Blueprint in partnership with the Aspen Institute, which also includes a specific focus on equity. And we'll be coming back to that. And as for myself, as you heard, I'm the director of the program in drama therapy at NYU, and I also chair our international initiative called Arts and Health at NYU, which brings together our schools and global campuses under the auspices of the arts and health. So we have a lot to talk about, and you know, I know this whole conference has been full of extraordinary ideas, many of which pertain to equity. I know that you had a keynote a couple of days ago specifically looking at the issue of race-related trauma and how that can be addressed through the arts. And so I'm just going to come in first with a big picture question around the arts and health at the WHO, because that is the, you know, that is the invitation has been to look at this from a global health agenda. So I'm going to start with you, Christopher, to tell us about that initiative. Tell us a bit about the Arts and Health Initiative at the WHO. Pass it on to you.
Well, thanks, Nisha. Maybe before I get started, I should just do a quick call out to Patricia in the previous section. And you were looking for international partners on the core curriculum. Well, you've got my number, so feel free to drop me a line. So at WHO, in many ways, arts have been part of our work since our founding in 1947, in the sense of we've always used the arts in all media in terms of health promotion. If you go back to things like the rollout of the DOTS program in Africa in tuberculosis, they use street theater, they use radio soap opera, they use songs, you name it. So in that sense, using the arts as part of a global health, public health frame is nothing new. What I think is new about what we're doing at WHO now is we're looking at it not simply as just health promotion, but looking at the evidence of whether or not engagement in the arts actually may have a therapeutic benefit. And let's be clear what we're talking about here. It's not always in terms of a clinical benefit. And for that, we should go back to, again, the 1947 WHO Constitution and our definition of health. It's the definition of health, according to the framers, is not just the absence of disease, but the attainment of the highest level of physical, mental, and social well-being. And so when you put it into that context, then thinking in terms of what benefit the arts might play becomes more intuitive. That, well, of course, that involvement in dance and the arts can help us achieve the highest level of our potential physically, creatively, in terms of our engagement with ourselves, each other, and the environment. And I think those three areas of physical, mental, and social well-being are very important. To take a concrete example, there was a group of clinical clowns that I was working with, and this group was called Elderflowers. They were from Scotland. And this one clinical clown described a moment where she was working in a nursing home with patients with advanced Alzheimer's, and many of them had lost their ability to communicate except for a few words. They were not engaging each other. There were concerns about their depression, etc. And even the healthcare workers themselves exhibited high stress levels. And this particular clown came in on Valentine's Day. And she began with this rather impassive audience by crying. And people slowly began to pay attention to her. And finally, somebody asked what was wrong. And she said, "It's Valentine's Day, and nobody wrote me a letter." And this Irishman, who had not been communicative with anyone for literally 3 months, suddenly got up, went down on one knee, put his hands together, and began to sing an Irish ballad. Now, what to me is interesting about this is not that this moment showed any kind of change in his condition medically. that the Alzheimer's was not reversed, it wasn't slowed, it didn't change his disease. But in that moment, he was able to fulfill his potential. He was able to reach out to another person. He was able to make people smile and recognize something deep within the brain. And socially, that community began to come together. And this is the sort of thing that the arts can do. And even beyond those three buckets that I described of physical, mental, and social well-being, the added thing, which is even harder to measure, is this notion of meaning, of when you're facing a misfortune, a change, being able to use the arts to articulate what that authentically means to you, not as an escape, but as a form of transcendence, of finding hope, and hope as a creative act. So at WHO, very briefly, we're very concerned with the research agenda. What are the measures of not just what are the specific measurable health benefits, but the holistic approach to engagement with the arts? Can we translate that into policy recommendations? And can that trigger investment in the arts for health at the community level, and to get that virtuous cycle moving? And so far, there have been, in this incipient stage, some interesting positive examples in every part of the world that I think are very hopeful that we're on a wave here that is quite beneficial. Everywhere from the sort of ground up, letting a million flowers bloom approach that we see in the US, to more top down approaches that we see in other countries that are also encouraging. For anyone who is interested in the WHO research on this, I would encourage you to look at our 2019 report on the evidence base for the health benefits of the arts that came out of UCL, which is a scoping review of some of the existing evidence. And in fact, I'm working with NISHA's group too on doing a deeper dive into the benefits of arts interventions that have a stated therapeutic intent, and specifically looking at target demographics of pre-adolescence and elder care, etc. Nisha, what else would be useful, you think?
I think that's a good place to begin, and then we'll come back. That 2019 report ended with a call to acknowledge and act on the evidence that we have. Yeah. And that is what I'm hearing already. Certainly that's been happening in NOAA, and it's been happening with each of our panelists here. And Khalid, I'm thinking about your work specifically as an artist on this panel. And I'm actually, we're not just going to talk about the art, we're going to show some of your art while we're talking. And so I just have a very small collection here of some of Khalid's work, where you can really see, first of all, the weapon here is the pencil, and how, Khalid, in my mind, you really link a healthy society to a just society. And so that connects to me to what Christopher was just saying around, that when we think about health, we're thinking about the physical, we're thinking about the mental, we're also thinking about the social. And I'll just show a few more of these. I end here with this particular quote from you, though we have you with us, so you could speak to this yourself. But I really appreciated the connection you made here in terms of resistance and healing. And others can look up Khalid on Google Arts and Culture, but for right now, I'll actually stop this share and turn to you with that question around the connections that you see between resistance and healing, between your work as a political cartoonist and the work of health and well-being, your own and in the communities that you serve.
First of all, I'm very happy to be here. Thank you all for having me. That first cartoon wasn't mine. It was a friend drew it about me. His name is Carlos Tatouf. He's a Brazilian cartoonist. He's probably in jail right now. He's always in jail. So what the connection is, not only with political cartooning, because political cartooning in a way is a very negative art. You know, we're always working with the news, and that means you're in this what now became this endless cycle of bad news, because sadly that's what sells, right? And you have to keep up with that. You have to, like, every day, you know, read the news, come up with something. Luckily, I don't need to do that because I'm an independent political cartoonist, which means I'm broke. But I work with I do it the other way around. So I do a work that I think is interesting, that I think is important, and then I you know, if an organization would like to use it, that's another thing. But all my work is under Creative Commons, and it's free to use and to share and all of that. My point is that we as artists, that we consider ourselves part of an artistic resistance, a cultural resistance, we are outnumbered, and we are going up against machines of misinformation and disinformation, and ongoing machines that get stronger and stronger by the day. And it's not only the pressure of not knowing how to keep going and how to continue this resistance, and how to continue being there for your cause and helping others as well. It's because at the end of the day, you'll find yourself just drowning in a lot of information and feeling like you failed, because no human being can fight this. And I personally have been through a time period where I, after the Arab Spring, of course, and everything that that happened, I just felt like there was no use. I wasted my life, I wasted my energy, I wasted everything. And because at a certain moment, you just realize that you're never going to win. And this is the issue here, is that how do we teach ourselves as artists? How do we teach ourselves as people that believe in change, in to take care of yourself, take care of your body, take care of your mental health? Because in our world as well, I mean, in Sudan, I'm from Sudan, or in the global South as a whole, the idea of, I think, taking care of yourself or taking a step back, no one has time. So you have to keep going, and because a lot of people depend on you, your family depends on you, and so on. So I think it's very important to bring these studies, to bring your support as professionals in this field to artists firsthand, because most of the artists don't know. They don't know what they're going through until they get hit with that wall, and creativity stops, everything stops. And that doesn't only affect the artist, it affects really the, you know, democracy and the freedom of expression and a lot of things. And this is kind of what our governments depend on. You know, we've been in Sudan personally today, millions of people are in the street today because people want to stand up against the military that wants to regain power. Again, after we had a revolution 2 years ago against al-Bashir, who finally got toppled after 30 years of dictatorship. So now the same military wants to come back. And the three things that toppled al-Bashir, our dictator, 2 years ago, were women, unions, and arts. And these are the three things that he's been fighting for 30 years, and they all came back. And this is what we need to support. And now it's been 2 years of ongoing, everyday fight to keep going, to just have the idea of a democracy implemented in this country that had the longest running war in Africa. So it's a long struggle, and not only for Sudan, and not it's again, you know, we could be talking about artists in America, we could be talking about Maori artists in New Zealand, we could be talking about artists in India. It's all about how to keep going. I hope I answered the question.
You absolutely did, Khalid, and you also, really, I think underline the importance of, when we think about the arts and health, we're also thinking about the health of the artist, and we're thinking about how to sustain the artist who is slipping in between these spaces and allowing a movement to be nourished and fed and to continue. You sort of joked a little bit about, I'm a political cartoonist and that means I'm broke. And that's a critical gap right there. How do we sustain the arts as partners in healthcare, but also artists specifically? And I know that NISHA, I'm just going to use that as a segue to turn to you, because I know you've been really creating a platform for artists as part of the Hamwe Festival, especially with a lens towards health and equity. And could you speak a little bit about that?
Sure. Yes. So the origin of this project was really a reflection and based on all the evidence that we could observe in what was already studied. Even if there's still a lot of work to do, there's some evidence that there's some benefits of artist as a partner, art practices for your own life. There's a lot of things that could be used in day-to-day life and in the health sector, and especially, for example, in countries and places with low resources. Why not, use those untapped resources? So that's a bit of how we started, and in a reflection. For me, it was when I initiated that, it was based on my own experience, but I realized that it was not so hard to convince people to join on this. So that's a bit of how we started in 2019. And we had a very interesting, all type of responses, and from very various places, from the creative, the creatives, different type of creatives, from artists themselves to cultural policy level. We had also responses from the health policy level. We had responses from academics, researchers, clinicians. I was like, okay, there is definitely interest, and that's exactly what we wanted, right? A platform where all those people would collaborate or find ideas to collaborate, learn about each other's barriers, challenge, and also the positive side, like what an artist can add to your work, to your setting, to your hospital, and so on. So that was really encouraging as a response, and that's how we decided to continue. And in order, because what happens at the intersection of arts, health, culture, so large, so vast, so much could be done. So we decided to stay focused a bit and to have one thing that we develop a year, and that the theme should be based on generally the questions that are around, that are discussed in the, we want to stay connected to our surrounding. So what we saw from discussions with youth group, discussion with community as workers, discussion with our policymaker here in the health sector, there was a big interest on mental health. There's definitely a global mental health crisis, Africa aggravated, and then in Rwanda with our history, there's also an additional layer. And we decided that we'd rather be helpful. So if people have interest in talking about mental health with us, we'll see what can be done. So we focused on that, and again, very interesting conversations. and things that actually we did not have before. There's a story that I think I shared with you already, NISHA, about this artist that was saying that in the community, they're not very convinced by the mental health services that are around. And like, okay, well, there's already a service gap. So if people are not using it, that's something that we definitely need to understand. And we saw actually data was showing that this was possible, that there was underutilization of available service. And so we explored and talked with different people and learned a lot. For example, we talked with clinicians that were saying that they were trained in English and in French, and that suddenly they have to practice with people that are speaking our national language, Kinyarwanda. But you know, language, there's the words, but if some words are not translatable, that means that maybe some concepts are conceived and understood differently. If the language is some sort of expression of a different way of seeing the world. So that means a lot. And when the more we explored, we say like, oh wow, that's a very common experience of all those practitioners. And they were saying basically that they spent the first 1 year to 2 years of their career to sort of adjust what they've learned to what they have to do in terms of metaphorical language. So all of that, and we thought, that's something that basically the health sector didn't figure out by themselves. But though now that we talk about it, it seems so straightforward, right? And I wonder why, for example, if those people do this work, how come it's not, I don't know, recorded somewhere, transformed into some sort of a curriculum? Why wouldn't there be a class, a course? And maybe it's applicable here in Rwanda, but maybe it's applicable in all countries that don't function with I don't know, Western ontology. So how do we? So we wouldn't have seen that without another way of looking at a problem and another way of problem solving. So there's all type of benefits. And for example, now this is something that as a university, actually, as a university in health science, that is something that we can start working on. So those are the type of things that we're looking for. And so Hamwe, with all these conversations, they generate different type of programs, and sometimes they generate, most of the time, a topic, and questions generate more questions, and those questions influence the topic of the festival. And so what we try, as we mentioned equity, we are the University of Global Health Equity, so this is at the center of everything that we do, is definitely to be inclusive, to make sure that we are addressing equity, health inequities with what we do. So in mental health, so for example, the topic was mental health, but we included social justice. So that's very key to what we do. And I think with this partnership with the arts, there's a very interesting way to address that. For example, we always come down to definition of health. What is health for me? How do I, and then what is well-being for me? What is well-being across cultures? There's a lot of service. Where does service come from? Is it adjusted again across cultures? So there's a lot of questions around gender, race, colonization, and those allow this platform allow to address those questions in a different way, in creative, in a collaborative way. And those are complex questions, so it's great to look at it from a multidisciplinary approach. So that's a bit of how we include equity.
Thank you. Okay.
Yeah.
I mean, I see you've spoken to so much there, both in terms of noticing what's happening on the ground and not using the same measure to assess the benefits of every intervention in the same way, that you really have needed to diversify the scope through which you examine what's working and how. And you've spoken to about cultural responsiveness and being able to situate yourself within the cultural landscape and universe of the people that you're working with. And, materially that sounds like the language in which people are speaking. In Kinyarwanda, for example, that just on that level, though it may seem obvious, it wasn't an obvious thing. And so these other learnings are being shared, and we're so thankful for that. I'm going to pass this on now to Susan. Susan, you've been working in this area for such a long time and in such a substantial way with the NeuroArts Blueprint specifically. You have a piece in there around equity being really critical and foundational to the development of the arts and health as a field. And could you speak a bit about that?
Sure, I'd be happy to. Just listening to my fellow panelists makes me really deeply reflect on the fact that artists have always been the folks that have carried the banner, right? Have really shined the mirror on what's happening in culture and society, and have taken tremendous burden in doing that. And I'm just so grateful that to be part of this group and listen to each of your stories and how we lift that up. The blueprint is really the goal of the blueprint at its core is to lay the groundwork to cultivate this field of arts and health in a systematic and systemic way, so that we bring all of the folks together, whether they are researchers, and that could be basic scientists or people in public health, any discipline, artists, policymakers, funders, other decision makers together. And when we started to look, and it's really the first 5 years, the next 5 years are really about trying to lift this up and really create the foundation for the field to coalesce. There's a lot of fragmentation. There's a lot of disconnects. There's a lot of language barriers. There's certainly inequitable relationships. I think COVID has shown that in terms of thinking about equity in health. We know that across the globe, how equity really is managed in different ways and often not to the benefit of the majority. And so the blueprint, we spent a lot of time thinking deeply and talking to people around the globe about what did equity really mean. And what we saw was that there wasn't just fragmentation, there was lack of voice, there was lack of framing, there was lack of understanding about what was required and what was needed, that many folks weren't even invited to a table, let alone deciding what the table should be set with and what the conversation should be. So really stepping back and looking at how at the beginning of any discussions, there has to be comparable representation, and thinking about what healing means around equity. Healing for the oppressed and healing for folks that have been left out, but also really coming to terms with, in many cases, certainly in the United States, sort of this white-bodied frame of mind. And what does it mean to really understand the other and to be able to really step up and step forward? And so I think we're in a time of healing and growth for everyone, where there needs to be attribution and acknowledgement, but there also needs to be a path, a process forward. And I think that's another place where the arts offer us opportunities to understand each other in better ways, by how we share, whether that's expressive writing or music or dance or theater, or film or digital arts. I mean, there's so many ways that I think we can know our deeper selves and not just that top layer that's become so stereotypic and so implicitly biased. And so the blueprint really is looking deeply at how to do that. Ultimately, it knits together all of these constituencies to try to create an ecosystem. I just want to step back for a second and talk a minute about why neuroaesthetics. What does that even mean? And I think I talk about this in the sense that we look at the moon, or we look at the sun or the stars, and we think they're so beautiful. There's so much awe and wonder, and we're moved by nature. We're moved by art. Neuroaesthetics is really trying to understand at a biological level, what's happening in our brains and bodies, and how what we're experiencing affects our behavior. And I think that's important as just one cast of characters in this beautiful symphony that allows us to understand a new way of knowing. So if we understand how something might move us or change us, we have the ability to use that in better ways. And I think of it as information that artists can take up and use in their own unique way, or other kinds of practitioners can use. So what we've been doing in our lab is really trying to understand the neurobiology of the arts and the physical biology of the arts, and how that gets translated in an interdisciplinary way, including all of the stakeholders who are involved, whether it's around physical health, like Parkinson's and dance, or Alzheimer's and music, or thinking about community health and mental health and identity, and the ability to be able to create community, thinking about isolation and loneliness. And I think at the root of all of this is this idea of expression, our ability to really express ourselves and to be seen and understood. And I think that comes full circle back to what Christopher is talking about when he talks about what it means to be human and what does health really mean. So I'm excited that we are all coming together from different points of view to create something that none of us could do by ourselves. And I think that's really beautiful. So it's sort of an army of artists and researchers who I think have a shot at making this stick in a way that's important for humanity. So thank you for letting me be part of this.
Thank you, Susan. I know we have about 10 minutes-ish, and we've already got a number of questions that have come through. Some of them are very specific to how we nourish this, how we continue to lift up this symphony, how we continue this powerful play. Somebody asks, does the WHO work with the US National Institutes of Health? And I will just say, yes, we are working with them. Some of us individually in our work, but some of you might know that the WHO has partnered with Culture Runners, the Met, Johns Hopkins, NYU, to launch a symposium called the Healing Arts New York, which launched September 19th, and another symposium is planned for November 14th. And you can find out more on the Culture Runners website, as well as the Met Museum and WHO eventually. And I'll put those links in the chat in just a moment. But I mention it because we will have NIH and NEA representation at that symposium. So you'll hear more about that collaboration there. So to that question. Somebody else asked specifically to you, Christopher, if the WHO is working in the arts and health in Chile and Argentina. You're muted.
There I was being polite by muting myself. In terms of my little group, not yet, but in fact, recently I've been working with UNESCO to bring in the UN culture part as part of this global partnership, and they have deep roots in Latin America as well. So I'm very much looking forward to collaborating with folks in South America. I've already started some collaboration with Mexico and Central America, but would love to go further south.
And we also have similar questions around other countries like Canada, and there are a few other countries that have been mentioned that I'm seeing in these questions. And would you say the same response? Are there specific?
Well, I think it depends on the countries. Some countries we've already begun working directly with, like there is an interesting WHO program on using music to combat postpartum depression in young mothers. And the pilot programs are currently in Denmark and Romania, as an example. The partnership that we have with INJONGE in Rwanda is several years old and will actually be part of the Healing Arts Activation Series a year from now, when at the next Hamwe Festival, we're also going to have a healing arts activation in Rwanda. And just to bring it full circle, I'm talking with the National Black Theater, whom NISHA introduced me to in Harlem, of bringing together Black theaters from around the world as part of the diaspora to do something special for that Rwandan event. Black voices in every corner of the globe, including, interestingly enough, a Black theater in Norway.
That will be really exciting, and we will look forward to following the festival. And I think this goes to Claire's question too, which has to do with the WHO Arts and Health Plan, initiative, timeline, and other activities. And I'll just reiterate this piece around city-based activations as a means of discovering new partners, discovering new initiatives, and opening up sometimes similar conversations or new conversations in this area, but with new partners or a mix of folks who've been involved for some time, as well as new partners. And that's a little bit like how this particular panel came together. We were planning for an activation in New York and found out that NOAA was hosting a conference around the same time, within the same timeline, and saw an opportunity to collaborate. Are there any other questions? Is WHO in Guatemala for this type of arts and health work too, or Central America?
Not yet, but a little bit in Nicaragua. But again, Guatemala would be very interesting, I think. Also, to get back to Claire's question, one of the activations that we have planned, actually with NISHA as well, is in Abu Dhabi in January, and we hope to, at that point, be able to publicly announce some news in terms of WHO's escalating investment and involvement in the arts and health area. And that one in particular is going to be around monitoring and evaluation and a global effort in that. But I can't say anything more because it's not finalized.
Thank you. So it's growing, and it's growing in a decentralized way, in a way where there are multiple efforts happening around the globe, and at points we get to come into contact with each other. I'm taking a look to see if there are any final questions before we move to a close. There are some fabulous comments too about the importance of this work, and thank you, Susan, for sharing when the release of the blueprint is. Barbara asks, does the NeuroArts work with different ways of knowing?
Yes, absolutely. I think that's the critical juncture. Is there are so many ways of knowing, by working with folks that are creating art, sharing their knowledge through art making, looking at ways of knowing through public health, looking at ways of knowing through science. So there is not one way of knowing. And I think when we bring all of these ideas together, we have new insights on how to think about solving problems. And I think the arts and health at its core is solution oriented, right? And so the more ways we have of addressing something, the more likely we are to solve and to continue to heal and grow.
And in fact, Susan, if I can just jump on that, one interesting observation I've seen from neurologists when we talk about things like the talk therapy and using words and voice to deal with our emotions and situations is that if you look at it from a neurological point of view, the center of language is actually relatively small in the brain. And when we involve music, movement, dance, visualization, suddenly the brain can light up like a Christmas tree. It becomes this cross-referencing thing where we're using our entire mental and neurological being around something. And so to expand our forms of expression to beyond words, I think is extremely exciting, an exciting way of looking at it. And I think all of us have also experienced those moments of intense joy, sorrow, whatever emotion, and we say there are no words. Words sometimes are liberating, but they're also sometimes limiting, and define those modes of expression that go beyond the words is something I think the arts are uniquely suited to explore.
I'll underscore that just by saying there are no other interventions or experiences that use so many multiple systems simultaneously than the
Right.
art. So what could be better, right?
I want to thank everybody here on this panel for your wonderful comments. I know there are more questions. Absolutely, we work with expressive arts therapists. I'm a creative arts therapist myself. And yes, there's involvement from Canada as well. We won't get to all of those. I see Linda on, ready to remind us of time. But thank you for being part of this rich conversation. And thank you specifically, Khalid, Susan, NISHA, and Chris.
Thank
and
you.
Noah for the invitation.
Yes.
Thank you all so much. Thank you to our attendees. On behalf of everyone, we can't thank this extraordinary panel enough. And I think we would all love to sit here for hours more and continue the discussion. But we look forward to our afternoon sessions and hope you will all join us then. Thank you again, and we look forward to working with all of you and continuing the conversation.
Thank you. Thank you.